She was just checking vitals when the elevator cable snapped. Trapped between floors with a patient in cardiac arrest, Nurse Alexis faced an impossible choice: watch him die or reveal the surgical skills she'd hidden for 6 years. What happened next in that elevator would remind everyone why she'd once been called the ghost surgeon in Afghanistan. Welcome to Hidden Legends. Before we begin this powerful story of courage, skill, and forgotten heroism, tell me in the comments where you're watching from today. And if you believe stories like this need to be heard, hit that subscribe button and help us make sure they are. Alexis Chen had been invisible for 6 years at Metropolitan General Hospital's ICU. While other nurses gossiped during breaks, she studied patient charts. While they complained about overtime, she volunteered for the hardest cases. Her colleagues knew her as reliable, competent, and strangely calm during emergencies. But none suspected why. At 4:15 a.m. on a quiet Tuesday, everything changed. Robert Patterson, a 58-year-old recovering from triple bypass surgery, suddenly crashed. His monitors screamed warnings as his heart rhythm became erratic. "We need surgery immediately, doctor," Marcus Webb announced, checking Patterson's readings. "Call the OR." As they rushed Patterson toward the elevator, Alexis noticed details others missed. The irregular pulse pattern suggesting graft failure, the subtle skin discoloration indicating internal bleeding, the breathing pattern she'd seen before in wounded soldiers whose hearts were failing. Details that had once made her the youngest cardiac surgeon in military history. The elevator shuddered violently as they descended. Metal screeched against metal, lights flickered, and suddenly they were falling. The emergency brakes caught them between floors with a jarring impact that threw everyone against the walls. "Emergency services. We're trapped between floors with a critical patient, doctor." Webb spoke into the emergency phone. The crackling response chilled everyone. "Fire department is en route. Extraction will take 45 minutes minimum." Dr. Webb looked at Patterson's monitor. "We don't have 45 minutes. That's when Patterson flatlined. The cardiac monitor's alarm pierced the small space as his heart stopped completely. Dr. Webb began CPR while Alexis prepared emergency medications, but in the cramped elevator with limited equipment, they were fighting a losing battle. "How long can we maintain him?" Dr. Webb asked between compressions. Alexis checked Patterson's condition with the clinical precision she'd learned in battlefield hospitals. "Maybe 20 minutes, but without surgical intervention, we're just delaying the inevitable." Dr. Webb stopped compressions, checking for any pulse. Nothing. "There's nothing more we can do. We don't have surgical capabilities." That's when Alexis opened her medical bag. Inside Alexis's bag were instruments far too sophisticated for any nurse. Surgical clamps, specialized retractors, sutures that belonged in operating rooms. Dr. Webb stared in shock as she laid out equipment with practiced efficiency. "Dr. Webb, my name is Dr. Alexis Chen. I'm a cardiac surgeon, and I'm going to save Mr. Patterson's life in this elevator." Her voice carried authority that hadn't been there moments before. Her hands moved with absolute confidence, transforming from cautious nurse movements to precise surgeon gestures. "That's impossible. You're a nurse." "I've performed 127 cardiac procedures in combat conditions with far less equipment than we have here," Alexis interrupted, already preparing the surgical site. "I once did a triple valve replacement in a helicopter under enemy fire." She gestured to their medical equipment. "This elevator has better lighting than half the field hospitals I worked in." The authority in her voice in desperate circumstances convinced Dr. Webb. "What do you need me to do?" "Maintain ventilation and assist with retraction. His bypass grafts have failed and he's bleeding internally. I need to repair the connections between grafts and native vessels." Using Dr. Webb's supplies and her hidden surgical kit, Alexis transformed the elevator into an operating theater. Her hands navigated Patterson's chest cavity with perfect precision, as if she could see directly into his heart. 4 years in Afghanistan, she explained while making microscopic repairs. You learn to work fast, clean, and with whatever you have. Alexis worked with focused intensity that had once made her legendary among military personnel. She identified the bleeding source, a torn connection where the bypass graft met Patterson's main artery, and began repairs with sutures barely visible to the naked eye. There, bleeding controlled. Let's restart his heart. She charged the portable defibrillator. Clear. The first shock produced nothing. 300 joules, clear, still flatlined. Alexis placed her hands directly on Patterson's heart through the incision, manually massaging the muscle, a technique learned in battlefield medicine when equipment failed. Come on, Robert. Your granddaughter needs you to fight. After 30 seconds, she tried the defibrillator again. This time, the monitor showed weak but steady rhythm. Patterson's heart was beating. "My God," Dr. Webb breathed. "You actually did it." As rescue sounds grew louder above them, Alexis began closing with rapid precision. "We're not done. He needs to stay stable until proper OR care." "Alexis, who are you really?" For the first time in 6 years, she didn't hide behind her nurse identity. Former Major, U.S. Army Medical Corps. Cardiac surgeon attached to special operations units. My official record says I died in a helicopter crash in Kandahar, but that's not what happened. As rescue teams prepared extraction, Alexis monitored Patterson while revealing her secret. I was part of classified medical units treating special operations personnel. We operated in places regular hospitals couldn't reach, on soldiers whose missions didn't officially exist. She checked Patterson's heart rhythm, stable and strong. The helicopter crash was real, but it was targeted. Someone leaked information about a surgery I'd performed on a high-value prisoner who was supposed to die from his wounds. "So they made you disappear? Court-martial for violating orders or accept that doctor? Alexis Chen died in that crash and start over. I chose to disappear but couldn't stop being a doctor entirely. Nursing was close enough to medicine to feel useful, far enough from surgery to avoid questions." Fire department voices echoed from above. "Ready for extraction." Medical personnel first. Dr. Webb made his decision. "As far as anyone asks, you assisted me in extraordinary resuscitation. Nothing more." "Thank you." "Don't thank me yet. Tomorrow we need to discuss your future here." Patterson recovered completely. Official reports credited Dr. Webb with extraordinary resuscitative measures during the elevator emergency. Local news praised medical heroism under adverse conditions. 3 days later, in Dr. Webb's closed office, the real conversation happened. "I've reviewed 6 years of your work," Dr. Webb began. "Patient assessment accuracy, 99.7%. Emergency response faster than physicians with decades of experience. You've prevented fatal errors, identified complications others missed, and been present for every major emergency on your shifts." He slid documents across his desk. "These aren't nurse metrics. These are the performance indicators of one of the best physicians this hospital has ever employed, disguised as a nurse. I've been happy as a nurse. I don't need recognition." But Patterson needed a cardiac surgeon. "What happens next time we have an emergency requiring your real skills?" Dr. Webb leaned forward. "The hospital board wants you back in medicine officially. We're offering a cardiac surgery fellowship with full support for reestablishing credentials under appropriate discretion." Alexis stared at the contract. After 6 years of hiding, returning to surgery felt terrifying and exhilarating. "What about my past? We don't care about classified operations or political decisions above our pay grade. We care about saving lives. You've proven you can do that better than most doctors we employ." 2 weeks later, Dr. Alexis Chen began her fellowship in cardiac surgery at Metropolitan General. The official story: former military physician returning to civilian medicine after service in non-medical roles. But she still picked up monthly ICU nursing shifts, working alongside doctors she now counted as peers. When asked why, she always said, "Sometimes the best way to help patients is being exactly where they need you, operating room or bedside at 3 a.m. Robert Patterson sent monthly thank you cards. The doctor said what happened was a miracle. I guess angels wear scrubs instead of wings. The repaired elevator returned to service. But doctor. Chen always took stairs. When asked why, she'd smile. Old habits. Besides, you never know when someone needs help between floors. Some serve by leading teams and directing operations. Others serve by being present when one life hangs in balance, ready to use whatever skills necessary to tip scales toward hope. Dr. Alexis Chen served both ways, as the cardiac surgeon repairing hearts others couldn't save, and as the nurse who never forgot that every medical case was a human being needing someone to care about their survival. This story was brought to you by Hidden Legends. Heroes walk among us carrying extraordinary skills behind ordinary titles, ready to step forward when lives depend on it. Share their stories, honor their service, and remember, sometimes the person who saves your life might be the quiet one you barely notice until everything depends on what they know how to do.